Indian hospitals receive almost 75% of medical tourists from the Middle East. However, the biggest concern that these medical tourists have when they come to India for treatment is the meat they eat and the direction of Mecca. To instill confidence in patients from Islamic countries and provide them with suitable environment, hospitals are approaching Halal India for halal certification. Chennai-based Global Health City has become the first hospital in India to get this certificate, and the patients are happy that they feel at home when they get treatment in a halal certified hospital, as halal is a way of life for the Muslims.
So most of the patient Muslim, when they want to go for a medication, most of them, they think about the food, to have halal food. So when we came from Bahrain, we are thinking also about halal food. So when we came to Global Hospital, we got what we want. All the food halal, and most of the chef in the Global Hospital Muslim. So, and this one, it's good for the most of Bahraini or Muslim patient to come to hospital. They have halal food.
It's good to have halal food here, because all we are Muslims, we're supposed to have halal food.
The hospital authorities of Chennai branch of Global Health City say that even before they had the certification, they followed halal norms. But the certification is aimed at winning the trust of patients from Islamic countries. They expect an increase in influx of patients from the Middle East and are poised to extend the certification process in different branches across the country.
Halal certificate is important for basically one reason, that a lot of international patients coming in from Islamic countries, it gives them a lot of confidence for them about the quality of food and assurance for them, because they're all long-staying patients in the hospital. They stay for 2 months, 3 months, post-operatively also, so food is very important.
Top-notch hospitals like Fortis and Apollo are also trying for a halal certification. Halal India is an independent halal certification body which is recognized by Indian government and deals with certification of food, cosmetics and drugs as per the Sharia law. Authorities here say that after the Global City Health certification, several other requests have followed.
Facilities are there at those premises, whether it is hotel or hospital, and in some cases restaurant also.
How many hospitals have approached so far?
I think between 5 to 10 hospitals, in which among them few are really keen to take halal certificate right from the beginning, and few after this global hospitals, they are fully assured that yes, this is the right time to get the certification. So almost what I feel that in another 1 or 2 months we'll certify 5 to 8 hospitals at least.
Halal certification ensures that a host of Islamic eating and praying rules are abided by the patients even when they are away from their country. Halal India has a stringent audit system to make sure that the institution it certifies adheres to halal norms. If any discrepancies are found during surprise checks, they have the authority of revoking the certificate.
He is aware through us. We did the certification for Global Hospital. We assured that they have the prayer timings in their hospital. They have the Qibla direction towards which Muslims are supposed to pray. They have copies of Quran. So all these facilities come as a package in halal certification. So the patient who comes from other country, he or she feels at home, even if it is a different place. Critical, major or minor, there are 3 categories. If it is critical, that means we found it really horrible and it is not acceptable at all according to halal compliance, then immediately we revoke the certificate, because we trained them how to do it, when to do it, all the criteria of halal, and they didn't abide at all, then we immediately revoke the certificate.
Halal certification presents a win-win situation for both medical tourists from Islamic countries and domestic hospitals. While the patients are only too happy to be ensured that they feel at home, away from home, for the hospitals, it would mean an increase in medical tourists raking in the mullahs.